Hi, I'm Dr. Mike Milligan. I'm here with Janet Press. Janet, thank you so much for being with us.
Hi, Mike. Great to be here. It's so good to see you, and thank you for the invitation to invite me to sit down and talk with you.
Wonderful. Janet's on the cutting edge of everything. She's brought lasers, dental hygiene consultant with LVI. She's been on the cutting edge of everything, and she is again. And it's with Save a Tooth, and really it's about preserving the potential health for your children or your grandchildren for
their future, Mike. It really is.
Tell us about this, Janet.
Well, I'm involved in saving your teeth, or actually deciduous teeth. Your children when they're getting ready to exfoliate a tooth.
Right.
That modern science, like we all know, continues to move on and has recently developed uses for dental stem cells and capturing these cells from baby teeth that are naturally exfoliating. So it is about storing your tooth, saving your teeth for your future health.
Absolutely, and there's so many things that they can do now with these stem cells, and the future holds even more promise for what they can do if you get a disease, if you have a problem. They can use these dental stem cells and just absolutely improve your health and regain your health.
Absolutely.
Tell us about that.
You know, one of the things that's happening is that with dental stem cells, what we want to understand is that they're what's called adult stem cells. And what that means is that they're multipotent, meaning that they're available for different uses. Now, we're already using them in human trials for alveolar bone attachment. We're also using them in human trials for diabetes type 1. In the last 2 months, in the last 2 months, they've been able to take the dental stem cells that have been captured from deciduous teeth and grow islets and to put these cells into the pancreas, and their clinical trials with humans are actually showing that the increase in insulin from these new functioning cells is producing the insulin to get the child out of the classification of diabetes. So,
and diabetes is on the increase and all,
absolutely.
And we've got a way here that we can really stem that with these stem cells.
That's right. And you know, the process is really quite simple. And I look at this as it's a perfect opportunity for the general dental practice. You know, dentistry has always prided itself, Mike, on the fact that we are the ultimate preventors.
Absolutely.
That's what our model has been forever. And so when you look at the potential for dental stem cells, I think of it as the ultimate prevention.
I agree.
And you know what I mean by that is that the ability to save your child's dental stem cells for the future, for, like you said, degenerative diseases, and with these cells that you can use them potentially in the future, the near future. We're able to use them not only for periodontics, but also for the use like in diabetes type 1, but also the potential for the use in the cornea, neurologic regeneration for patients that are suffering from pain. And as the population ages, degenerative diseases create a lot of pain. So the potential is endless. It's quite exciting.
Absolutely, and it's on the near horizon, many of these things, and then the future is just endless.
Exactly.
And so let's get into the procedure here and the cost. So the procedure would be just before the tooth is ready to exfoliate.
Exactly.
When it's not flip it with your tongue loose, but a little loose.
Yes.
Then the dentist takes that tooth out, puts it in a container.
Yes, actually, Mike, it's an FDA-approved medical device. It's called Save a Tooth, and a lot of us are familiar with that already, because if your child's doing soccer or playing baseball and they happen to have a tooth that gets knocked out on the rough playing field, the coaches typically have this Save a Tooth container that's approved by the FDA for transport of dental materials or dental biology.
Okay. So, and then what happens?
And then what happens is that we would take this preserved tooth and ship it to a laboratory that specializes in cryonic preservation. And what that means is that through
Not chronic, cryonic.
Cryonic, exactly, thank you. And there is a company that's called Store a Tooth, and I'm bringing that up because, you know, when we're looking in terms of having viability and storing teeth for our future, we need to make sure that the process by us exfoliating the tooth at the dental office and then putting it into the container and sending it to the laboratory, that the laboratory takes this additional step in checking the actual tooth for viability or cell viability, so that the parent is confident that the actual stem cells have been proven to be worthy of storing.
They're viable. Worthy of storing before we go to the process of storing.
Exactly.
Okay, and then they're stored there as for the person's life.
Absolutely.
And these stem cells, they can be used for that person what's the possibility in the future that they might be used for a relative with a similar blood makeup?
That's a really great question and a really great point. That's actually in conversation, and the scientists, of course, are working with that concept and that idea.
Okay.
And so what's happening is that we do see that there is a potential for that, a crossover. And so, you know, there isn't any of us, whether we're an aunt, an uncle, whether we're a grandparent, whether we're a parent, a sister, that this is an opportunity for us to be able to work with our entire family and for everybody's future, for sure.
Absolutely. In fact, I'm already going to do this for my grandkids. I mean,
Sounds
just
great.
in visiting with Janet here about this, I'm signed up. I'm ready to go. We're in on this.
Good for you.
Absolutely.
You know, and
My
it's
three
very
grandkids, you
affordable, Mike, for you and your family, like all of our patients.
Right.
And the affordability of this, it's about $120 a year.
Per year, right.
And they give you, you know, for storage. We know this is a long-term storage process. So I looked at it with my nephew's children as my gift to them, and in our family legacy.
For their future health.
Absolutely.
It's just probably one of the very best ways to ensure the future health, especially if they end up with some chronic problems, health problems, to be able to treat that and bring them back to good health.
Absolutely. And you know, the company that does this is called Storatooth, and you know, I've done my research, I've done my homework.
Oh, you
and
do. Janet always does her research and her homework. Absolutely.
Thanks, Mike.
Well, you're one of the top speakers in dentistry.
Thank you. I look at it as a campaign for dentistry in the ultimate prevention. And that we're at the forefront as the dental professionals in the dental office to talk to our patients about the wonderful opportunity that they have for their families.
And this valuable service. And it's only one tooth that you need for this, just one primary tooth, because then they can culture those cells and have as many as they need.
That's absolutely right.
Yeah.
And the parents or the grandparents, the family, has an opportunity to make the decision about this, because we do exfoliate 20 teeth.
Absolutely.
And so
we need one good one.
They only need one. And it's just a matter of making the decision that this is what you want to do for storing for your future. So.
Now, is there any last things you'd like to say, Janet, before we close this? Very important information here.
Well, I think that what's most important is that we have this opportunity as dental professionals to make an impact way beyond what we actually do in the dental office, in giving our patients an opportunity to really save for their future and save for their health. We know that we have degenerative diseases. We know that accidents happen. If you think about the ability to grow skin in a burn victim, or to be able to replace the cornea, or to be able to, like I said, use these cells for neurologic repair for degenerative diseases. There's so many different opportunities that go beyond what we're already doing on clinical trials, like I said, with the mouth. So it's reaching out as a dental professional, and I take this as an opportunity for all of us to really become and show the public who we are, that we're all about our families and our love of our families' healthy lives.
So Janet, where do we go from here?
You know, Mike, thanks for asking. It's really important that we educate ourselves about this new information.
This new service.
Absolutely. And so it's through that education. I am lecturing on this process and the understanding about dental stem cells. Yeah, I'm really excited that I have the opportunity to get out there and educate my dental colleagues so that they're more knowledgeable about the processes and about how to educate their patients on this new concept and the ability for us to do this through the dental office.
And I think it'll be easy to educate those patients, because this is such a valuable service at such a low price, and they check those stem cells. I mean, why would you not do this?
Absolutely.
So
Absolutely.
It's just tell them what it is.
Yes.
So you're speaking around the country about this. You're the only speaker about this.
Yes, I am.
How do we get in touch with you, Janet?
Well, you know, you can contact me through my email, and it's japress@earthlink.net.
Okay.
And I'm more than happy to, you know, talk to you about what's going on, and also give you my consulting and my schedule for conferences. Because you know what, we've got a message here that the public needs to hear, and then really give our patients the opportunity to make decisions about doing this with Storatooth.
Right.
And
how do we get in touch with Storatooth?
it's www.storatooth.com,
Okay.
and it's an excellent company, and it's the company that actually would cryonically preserve your tooth for your child's
and
future.
they're the company that even tests it to be sure that it's worth preserving.
Absolutely, and
Right.
that's a very important part of
It's a very
this.
important part of what we're doing here.
Yes.
Right, okay. Well, fantastic, Janet. And they've got webinars on their site, and you can learn a
Absolutely.
lot more about this as well
Yes.
from that site, too.
Yes, you can.
Okay. Thank you so much for
You're
being with us,
welcome.
Janet.
Thanks, Mike. Thanks for the invitation.